There is one diabetes medication that has quietly survived decades of medical trends, hypes, new drug launches, and billion-dollar marketing campaigns. It was approved by the US FDA in 1994, yet for type 2 diabetes, it is the first drug most doctors prescribe even today. It is none other than Metformin. But what does it actually do to your body? How effective is it? What can go wrong? How can you avoid what might go wrong? And what has kept it at the top for so long? Let's talk about all of this. Before we talk about Metformin, we need to understand a little about how sugar behaves in our body. If you are not interested in this part, you can escape to Metformin section using the timecode below. Let's suppose you feel hungry and you eat something. The meal you eat contains sugars in different forms. For example, sugar you put in your tea is sucrose, which is made of one glucose and one fructose molecule joined together. When you eat it, your digestive system breaks each sucrose down into one glucose and one fructose molecule, then absorbs them into bloodstream. And many other foods also contain sugar, but in different forms. Bread, potato, and rice, for example, contain starch. Starch is made of thousands of glucose molecules linked together like a chain. When you eat them, your body breaks them down into individual glucose and absorbs them into bloodstream as well. And this way, after having a meal, your blood sugar rises. And by blood sugar, we specifically mean glucose in the blood, not other type of sugars. When your blood sugar rises after eating, your pancreas senses this rise in the blood sugar and releases insulin. Insulin works like a messenger. It goes to your liver, muscle, and fat cells, knock on the door, and say,
"There is too much glucose in the bloodstream. Take it up and bring the level down."
These cells take glucose from the bloodstream and store it or burn it for energy. This way blood sugar returns to baseline and everything is fine. But if your blood sugar stays too high for too long, your liver, muscle, and fat cells gradually stop responding properly to insulin. Because they have been exposed to high blood sugar for a long time and they are already full. It's like when you eat a huge meal and you don't want to eat anything at all, even your most favorite meal. When your blood sugar remains high for too long, the same thing happens in your body. Your so-called peripheral cells become full of sugar. They refuse to take any sugar in response to insulin, and this condition is called insulin resistance, which is the main cause of prediabetes and type 2 diabetes. When someone is diagnosed with type 2 diabetes, we always start with lifestyle changes, a better diet with low glycemic index and high fiber, more movement, and weight control. Lifestyle measures are the foundation of type 2 diabetes management, but sometimes lifestyle changes aren't enough to control blood sugar. And this is when Metformin comes into play. When you take Metformin, it works at multiple levels to lower blood sugar. It decreases appetite, slows down stomach emptying, reduces sugar absorption from the gut, decreases production of glucose from protein and fat in the liver, and increase insulin sensitivity in peripheral cells. That means your liver, muscle, and fat cells take glucose out of the bloodstream more easily. This helps lower both fasting blood sugar and postprandial blood sugar, or blood sugar after a meal. And this way Metformin controls blood sugar in people with type 2 diabetes and prediabetes. One of the reasons why Metformin becomes so popular is that it is classified as weight neutral. Unlike some other anti-diabetic medication that causes weight gain, which make blood sugar control more difficult over time, Metformin generally does not cause weight gain. It doesn't usually cause significant weight loss either. However, some people losing a modest amount of weight when they are on Metformin. In the UK PDS study, for example, people who took Metformin had a better cardiovascular health and lost some weight, while people on some other anti-diabetic medication gained weight. And both of these effects is quite desirable in people with type 2 diabetes, because weight loss improves insulin sensitivity and helps with blood sugar control in the long run. And its cardioprotective effect reduces risk of cardiovascular disease over time, which is one of the most common causes of morbidity and mortality in people with type 2 diabetes. Another advantage of Metformin is that it rarely causes hypoglycemia or abnormally low blood sugar, which is a medical emergency, and if not treated quickly, hypoglycemia can cause brain damage and even death within hours. For a diabetes medication being weight neutral or mildly weight reducing, not causing hypoglycemia and having cardioprotective effect is powerful combination, and Metformin had all of them. When you take metformin pill, depending on the formulation, it takes up to 3 hours to be absorbed from your gut and enter your bloodstream and start working. And unlike many other drugs, it is not significantly metabolized in the liver and it does not bind much to plasma proteins. It is eliminated almost unchanged by the kidney. That's why kidney function matters so much. And if your kidney cannot clear it properly, the risk of serious side effects like lactic acidosis increases. And more on that side effect later. If you take metformin on an empty stomach, about 50 to 60% of the drug reaches your bloodstream. Food lowers the peak concentration and delays absorption, which might not seem ideal, but it is still recommended to take it with a meal. Why? Because up to 30% of patients experience gastrointestinal side effects like nausea, vomiting, diarrhea, constipation, gas, bloating, and flatulence. And taking it about 15 minutes after meal can reduce these side effects. That's why it is recommended with a meal even when food reduces its absorption. We spend a lot of time and effort scripting, recording, and editing these videos. And as a small channel, every bit of support matters. If this video helps you even a little, give that like button a gentle hit and subscribe. It really helps us grow and continue creating content like this. For some people, side effects subside over time, but they can return if the dose is increased. That's why doctors start with a low dose and increase it slowly. Treatment usually begins with 500 mg dose at night because when you are asleep, it is easier for you to tolerate mild side effects. And the dose can be increased by 500 to 850 mg each week to the maximum dose of up to 2000 to 2500 mg per day. But dosing mostly depends on the formulation and indication. And this starting low and going slow approach gives your body and your stomach to adapt to the medication. And there are two main forms of metformin: immediate release and extended release. Immediate release gets released into your stomach right after you take it. And extended release gets released into your stomach slowly and absorbed gradually. And the extended release formulation is more convenient because you take it once daily, not twice or more. And gastrointestinal side effects are also about 50% less common with extended release compared to immediate release. Again, because the drug enters your bloodstream more slowly and steadily. In addition to digestive side effects, people with advanced kidney disease, liver disease, or heart disease may not be able to take metformin because of a rare but serious side effect called lactic acidosis. And if kidney function is mildly reduced, patients can often still take metformin, but your doctor should be monitoring them closely. Only in severe renal dysfunction with the GFR of under 30, metformin is out of the table. Remember, metformin is not metabolized by the liver and it is eliminated by the kidney almost unchanged. If kidney function is impaired, toxic levels can accumulate in the bloodstream and increase the risk of serious side effects like lactic acidosis. It's also avoided in significant liver impairment. But you might question, why? The drug is not metabolized by the liver. Why liver function even matters? It's true that metformin is cleared by the kidney, but lactic acid is mainly cleared by the liver. When liver function is impaired, lactic acid can be cleared properly by the liver, and the risk of lactic acidosis increases as well. And lactic acidosis is a serious life-threatening side effect of metformin, but it is rare, occurring in 1 in 30,000 patients. And if it happens, symptoms might include nausea, vomiting, deep fatigue, shallow breathing, dizziness, confusion, and in severe cases, it can lead to coma or even death. But almost all people who develop this condition have an underlying risk factor that make them more susceptible to developing lactic acidosis. Conditions such as advanced kidney disease, liver disease, heart disease, advanced age, severe infection, heavy alcohol use, dehydration, IV contrast for specific imaging, or major surgeries, and the list is long. That's why before major surgeries or certain X-ray or CT scan imaging with contrast, your doctor may temporarily stop metformin. And if someone develops an acute illness with severe vomiting, diarrhea, or dehydration, temporary discontinuation may also be needed. Long-term use can also cause vitamin B12 deficiency and sometimes folate or calcium deficiency. This doesn't happen to everyone using metformin, but it can happen in some people after 4 months of use in a dose-dependent manner. Because of this, American Diabetes Association recommends periodic monitoring of vitamin B12 in patients with anemia and neuropathy. If you feel fatigue or peripheral neuropathy symptoms such as tingling in arms and legs, imbalance, or trouble concentrating while being on metformin, your vitamin B12 should be checked. Hypoglycemia with metformin alone is rare, but the risk increases when you combine it with other anti-diabetic medication or when you take it on an empty stomach, during intensive exercise, or with excessive alcohol. And the direct interaction also matters. Certain medications such as carbonic anhydrase inhibitors, cimetidine, iodine-based contrast agent, and alcohol can increase the risk of lactic acidosis. But overall, metformin is safe, tolerable, cheap, accessible, and widely used anti-diabetic medication. But it is not only anti-diabetic, metformin is used for many other purposes too. Doctors prescribe it off-label for pre-diabetes, and it is the only one that American Diabetes Association recommends for certain high-risk pre-diabetic patients. An schizophrenic or bipolar patient who gain excessive weight as a side effect of antipsychotic medication also take metformin to lose that extra weight. It's also widely used in polycystic ovary syndrome or PCOS, and in these cases, it lowers insulin level and reduces LH and androgen levels, which are the hormonal imbalance involved in PCOS. As insulin and androgen levels decrease in a lady who suffers from PCOS, menstrual cycle may regulate, acne may improve, excessive hair growth may reduce, and fertility chance may increase. So, women of childbearing age who take metformin should understand that pregnancy may become more likely when they are on the metformin. And researchers are studying metformin for anti-aging effects, cancer prevention, and possible neuroprotective effects. But it is not officially used for these purposes yet. All of these properties for a drug that is more than 30 years old is impressive. Metformin may be old. It may be inexpensive. It may not be trend on social media, but 3 decades later, it's still the backbone of type 2 diabetes management. There are some supplements that are said to work like metformin, but the scientific evidence behind them is controversial. They might help slightly with blood sugar control, but they are not alternative to metformin. Supplements like inositol, berberine, watermelon, fenugreek, and gymnema are often mentioned. And among them, berberine shown to have similar effect on blood sugar as metformin in some studies. You can try them out, but don't replace prescribed medication without medical advice. And in this video, we talked about a case study of a man who brought his HbA1c from 14.9% down to 4.6% without medication or insulin, just with lifestyle changes. If you are interested, check this video out. His story is absolutely jaw-dropping.